Welcome to the Live Fit Podcast, episode 136, Your Longevity Blueprint with Dr. Stephanie Gray. Back to that conventional medicine analogy that we had at the beginning, and even an allergist is a fireman. He's here to put out fires, right? So he's going to test you for that anaphylactic, that very strong allergy response. What we do that's a little different, because I have patients who actually have seen allergists who are told they're normal, they have no allergies, come see me, and instead we do a slightly different test. We do a sensitivity, or you could call it an intolerance test, and we do find results. So allergists are looking for full-blown allergies. They're not looking for sensitivities always, and that's something that, again, since functional medicine aside, we are looking for, we'll just say, reactions that are to a lesser degree that may not be as recognized as the full-blown anaphylaxis to an allergist is. Believe it or not, those proteins I mentioned in dairy, they will bind to opioid receptors, similar to drugs. And so when you stop dairy, especially if your body's become accustomed, if you had years, I have patients, again, I'm from the Midwest, so I have patients who were raised on dairy farms. You know, they've had milk 3 meals a day for decades. And so now when I'm asking them to go off the dairy, they're actually going through withdrawal. Foods that you crave often are foods that you do have sensitivities to, because as you're going through withdrawal and your antibody level, or we'll just say that immune response, as that's going down, many times you'll crave the foods to bring it back up. That's the reason why many patients don't go through with it, is they feel so darn lousy, they don't want to, continue to avoid the dairy. But that's a great indication that in actuality, you should take a break from it.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Thank you, everybody, for listening. I am really excited today because this is the Live Fit Podcast's 5-year anniversary. That's right, it was the weekend after Thanksgiving 5 years ago that I put together my first 3 podcast episodes. I was scared. I was nervous. I had no idea how they would turn out, how I would like doing it, how it would be received, and how many I would do. But I knew that I had some experience in the broadcast industry. I had some experience in editing audio for film and TV. I had other experiences that I really wanted to share. At that point, I had been working in the health and fitness industry for 15 years, and I was learning tons of stuff every day, educating myself, learning, experience, all this stuff, and I just couldn't stand to share it with only one at a time. So I went back to school, got a master's degree in exercise science so I could teach at the college level, which I did, which was great. And teaching 20 to 30 students at a time was great, but I still wanted more. So I started this podcast, and I do everything I can to bring you interesting, unique, and most of all, important, valuable guests and information that will help you live your life that is healthy, fit, and free of avoidable diseases such as diabetes, heart disease, and all those other things that come with being overweight and out of shape and eating poor foods. There's so many ways that you can steer away from that iceberg. I just want to make sure I present you with as much information as possible so you can make a smart decision. And I'm still looking for your input. I have my livefitsurvey.com up, and I'm asking you, what are your thoughts? What are your feelings? What do you want more of, less of, or something brand new? What sort of topics would you like me to cover? Anything at all, if it's pertinent, even close to Live Fit, to me, or the podcast, let me know. Once again, that's livefitsurvey.com, livefitsurvey.com. Today, I am pleased to have Dr. Stephanie Gray as my guest of the show. She is the author of the best-selling book, Your Longevity Blueprint, and she's the owner of the Integrative Health and Hormone Clinic in Hiawatha, Iowa. She is arguably one of the Midwest's most credentialed female healthcare providers, combining many certifications and trainings. In her book, Your Longevity Blueprint, Stephanie shares the most progressive functional medicine testing options that are currently available, as well as Your Longevity Blueprint nutraceutical products. From gut to hormone health, optimizing your nutritional status to your genetics, and even detoxifying your body is what Stephanie is excited about. Now, let's hear why Dr. Stephanie Gray says you are like a house. Thank you, Stephanie. Give us a really brief overview of what functional medicine is and what you do at your clinic.
Sure. So I'm a functional medicine practitioner in Eastern Iowa. My husband and I run the Integrative Health and Hormone Clinic. He's our office manager, and we have a wonderful team working with us who's very passionate about helping patients get to the root cause of their problems. So I have a colleague, Dr. Patrick Flynn, who created an analogy that I like to share with patients because I think it's excellent at conveying really what we do. So we need conventional medicine. By all means, we need conventional medicine. If you get in a car accident, you may need surgery. Really, that's what conventional medicine offers us, surgery and then also drugs. And if you have an infection, you may need an antibiotic. And so while conventional medicine is very necessary upon discharge from a hospital, like if you have a heart attack, conventional medicine doesn't always educate that patient on how to prevent future fires, right? They're the fire department, they can put out the fires, but they don't always work to prevent them. And that's where functional medicine comes in. So what we do at our practice is try to work as more of a carpenter or a contractor. And I explain that in my book, Your Longevity Blueprint, where we help patients try to build a healthier body using the functional medicine principles, really getting to that root cause, preventing future fires from happening.
I love what you said about being a contractor, because that's a lot of what I see as we're building our body. And this is the body that we have for the rest of our lives. So we might as well treat it as well as we can. If you own a house, you probably do maintenance on the house to maintain it. Yet further down, the way the house was built in the first place really has a lot to do with it. And you may not be able to go back in time and, change your 12-year-old eating pattern, but certainly now you can work towards improving your health or at least maintaining the health you have.
Exactly. We do a lot with our homes without even thinking about it. We keep hair out of the drains, we mow our lawns, we change our furnace filters, all things to really promote, we'll just call it the longevity of our home, right? We want to live at home a long time. And the same is true with our body. And while many individuals know, okay, I should get ample sleep, right, good rest, I should eat relatively healthy, patients don't always know what they can do above and beyond that with physical exercise to really help build a strong, really I'll say strong foundation, which is gut health. But then above that, how can they build their longevity? And so that's what we do at our practice. We have an 8-step plan where we work patients through various functional medicine testing options. We heavily work with nutrition and supplementation to help them build that longevity and really reestablish the maintenance that they need that they may not have been aware they needed.
Can you give us an idea of what this 8-step plan involves?
Sure. So again, all of these principles are outlined in my book, and I'll try to not make it too lengthy. But what I'm doing throughout the book is I'm comparing how we maintain the home to our body. So for instance, chapter 1 is all about restoring gut health. You have to have a strong foundation of that home without cracks, right, to support the entire household. And same with your body. You need a strong gut. And so really I'm comparing, again, the home to an organ system within the body. And so chapter 2 is all about maintaining the framework of the home. I'm comparing that to the musculoskeletal and nervous system, really keeping your spine in line. Chapter 3 is all about the electrical work. And so I'm comparing that to your genetics. There are some genes that we want turned on and some of our bad genes we want turned off. Chapter 4, I'm comparing really the doorways and the keys needed to unlock those doorways in our home to nutritional deficiencies. We want to have the right nutrient to unlock the appropriate pathway in our body, so we don't want to be deficient. Chapter 5 is all about tackling the laundry in the home. I'm comparing that to the liver and the gallbladder, or detoxification for the body. And then chapter 6 is my favorite, talking about managing your heating and cooling system in the home, comparing that to the endocrine system in the body, really optimizing the hormones, the thyroid and the sex hormones. And chapter 7 was probably the easiest analogy to make, having clog-free plumbing. You don't want clogged pipes in your home. Similarly, you don't want to have clogged arteries or veins. So I'm talking about reducing cardiovascular disease in that chapter. Chapter 8 is all about maintaining roof integrity. And I'm comparing that to your immune system in the body, really treating underlying infections and strengthening the immune system. And chapter 9 is all about how to get started, how to find a functional medicine contractor to walk you through all of these steps.
That is amazing. You've spent a lot of time putting all this together.
I sure did. I unfortunately had some health struggles myself, and I had to figure out a plan to regain my health. And my husband said, well, we might as well create a blueprint for our practice for all of our patients. And so that's where this arose from.
You know what I love about this job is I get to hear everybody's stories. And everybody I have on is geared towards improving their health in a, as natural way as possible. The stem cell therapy is the least natural and somewhat invasive, usually with just a needle prick or two, rather.
Sure.
Yet it's still taking care and treating the body in a natural way. And what I'm getting at with this is what's amazing is all the different stories that brought people to practice what they're practicing and to share. I started off as a personal trainer, and I think part of that was because of some family members and some people that I had in my life as I was a kid. I saw how they were, I guess, not treating their body with respect and not treating their body as if it needs to carry them around for the rest of their lives, and not thinking about what it will be like when their body breaks down due to poor maintenance. And you shared right there that you were having some issues you were trying to solve, and then once you did, you went, aha, maybe other people can benefit from what I've learned.
Absolutely. That's the best. I would agree. That's kind of the best part of my job, hearing everyone else's story, how desperate they are to begin with, and then really their story of hope. Once they have recovered through that healing process, then they want to go share their story with others. So I love my job. I'm very fortunate that I'm able to help patients and just assist them along their journeys. That's
terrific. Is there anything that any of the listeners can do to help maintain their health if they don't feel like they're in bad enough shape that they need to seek a professional like you? Is there something that someone can do that may improve things that they may not be quite aware of, or aware that they're having an issue with, or maybe just prevent something down the road?
Sure. So I could probably answer that question several ways, but I'll start with really echoing what chapter 1 is all about, which again is your foundation, which is gut health. And so I heavily describe how to remove food sensitivities and gut infections, which can sound a little complex, but it's really not that complex. So what my answer to that question will be is really working to reduce the inflammation by removing the top allergenic food groups, at least short term, in an effort to reduce gut inflammation and prevent potential autoimmune diseases. We think, autoimmune diseases are on the rise, and I certainly don't want to get one of them. So I want to do everything I can to reduce inflammation. And we think that the autoimmune diseases start with gut inflammation. And so the top food groups that can be taken out of the diet, either long-term or even short-term to start, are gluten, which is the protein in wheat, barley, rye, and oats. Some oats are gluten-free, but you got to make sure they're gluten-free. So I'm okay with oats if they're gluten-free. Dairy. So dairy contains the proteins casein and whey, which are highly allergenic. So we're talking cow's dairy specifically here. Eggs and sugar. So those are the top 4 food groups that we have patients take a break from. Again, at least short term, if they can commit 100% for 100 days, they may just find that they feel a lot better. They may not even realize they were a little sluggish, or maybe they had a little brain fog. And then when they can reintroduce those foods, they can pay attention to how they feel, and they may then choose longer term to keep some of those food groups out, while others they may be able to reintroduce back in.
Several years ago, I heard that dairy might not be so good for you, so I decided to give myself a little test, and I'm often my own guinea pig when I read about or hear about certain eating ways. I started off when I was about 12 years old experimenting with some diet my mom was doing, and not to say that I was trying to lose weight or I took it to an extreme. I just tried it for a day or two just to see what it was like, and why is there a book on eating nothing but tuna and grapefruit for a day? What's that like? I couldn't do that for a whole day, but I did it for like a couple meals. So I tried to go without dairy for 1 week was my goal, and I made it 2.5 days, and I had such a craving for milk. I really, really felt I had to drink milk. I'm not a big milk drinker now, but at the time I would have probably a glass of milk every day, and some in my cereal and maybe some in a latte. And that was the hardest thing to give up. And my wife has said the same thing too. She'll, for whatever reason, try to go without dairy, and that's, or try to go without certain foods, maybe these that you mentioned, the gluten and the dairy and the eggs and maybe even meat. And that's what keeps bringing her off it, was just this insatiable desire for milk.
So do you know what's happening there?
That's what I want to know. Tell me, please, what's going on? Is this an addiction? Am I an addict, a milk addict?
So in a way, yes. Many patients, believe it or not, those proteins I mentioned in dairy, they will bind to opioid receptors, similar to drugs. And so when you stop dairy, especially if your body's become accustomed, if you've had years, I have patients, again, I'm from the Midwest, so I have patients who were raised on dairy farms. They've had milk 3 meals a day for decades.
Right.
And so now when I'm asking them to go off the dairy, they're actually going through withdrawal. That's exactly what's happening. Foods that you crave often are foods that you do have sensitivities to, because as you're going through withdrawal and your antibody level, or we'll just say that immune response, as that's going down, many times you'll crave the foods to bring it back up. And so it sounds like both you and your wife would highly benefit from pushing through that withdrawal process. It sounds like you both probably do have a dairy sensitivity. But unfortunately, that's the reason why many patients don't go through with it, is they feel so darn lousy, they don't want to, continue to avoid the dairy. But that's a great indication that in actuality, you should take a break from it.
How long will I feel rotten?
It really depends on the patient. So so everybody, just like if you think of, not to compare you to a drug addict, but
it's too late. I'm already putting that comparison in there.
Many patients metabolize drugs at different rates, and everyone is different as far as how long it's going to take to clear that of their system, or for you, to reduce those dairy antibodies. Usually it's not that long. So some patients have a few rough days. They could have a rough week, but it's usually not going to be longer than that.
All right. Now I'm thinking of trying that again. I don't want to be addicted to anything. I'm my own person.
Well, I'll tell you, dairy has growth factors. I mean, when we think of it, milk fattens up cows, right? And most of patients want to lose weight. And so simply by having them take dairy out of their diet, well, one, we're greatly reducing cardiovascular risk because it is so inflammatory. Two, they lose weight. But three, it greatly benefits their hormones. Now, personally, I have had several surgeries for endometriosis. And, I'm very thankful for functional medicine principles, because I think some of the greatest value I've had from it is the diet changes, those recommendations, because my story is long, but, after going dairy-free, I was able to get pregnant. And I do strongly feel that taking the dairy out is what reduced the inflammation and allowed for proper implantation and a, continued pregnancy. So, it's maybe easier to be dairy-free when you can see the fruit of that. My brother had chronic migraines for years, and eggs and dairy were both his triggers. And so it's easy for him to stay off of them, because when he'd have them, he'd have a debilitating migraine. But for others, if they don't have that severe symptom, it can be more difficult to know, do you really need to go off dairy or eggs or gluten or whatnot? And that's where a functional medicine practitioner can be of great assistance, because they can test you to see which foods you do need to avoid.
I've been hearing for years that dairy causes mucus buildup, and I constantly have to clear my throat. And my kind of what I found out was the problem, and I'm not saying I'm 100% correct, or maybe it's just a joint problem, but I thought it was allergies and postnasal drip. So I've worked with, allergy treatment and response, that sort of thing with the sprays and whatnot. And it does help, but it doesn't completely get rid of it.
So you're right. Many patients who have, firstly, seasonal allergies have a cross sensitivity, meaning they also have food sensitivities. It's pretty unlikely that patients only have one, because when you think of that, that's a driven immune response. And so when you're sensitive to one thing, you're at a greater likelihood of being sensitive to a second. So probably you've done the right thing, but you've missed part of your puzzle, and that I guarantee there is an underlying other, food sensitivity, not just environmental allergy wise, but food sensitivity wise. But you're exactly right. Dairy has been known, especially in the functional medicine world, for causing a lot of mucus, a lot of chronic, we'll say, rhinitis, or constantly clearing the throat. A lot of patients who get chronic upper respiratory infections, even ear infections in children, can be a result of dairy sensitivity. And many times taking my patients off dairy, once they get through the withdrawal and they get through, the difficult part, they feel tremendously better, and that, that mucus is significantly reduced.
It seems really strange that I spent a good hour with an allergist. Actually, twice in my life, I've spent probably even 90 minutes with an allergist, did all kinds of testing and talking and whatnot. And that never once came up.
Yep. So back to that conventional medicine analogy that we had at the beginning. And even an allergist is a fireman. He's here to put out fires, right? So he's going to test you for that anaphylactic, that very strong allergy response. What we do that's a little different, because I have patients who actually have seen allergists who are told they're normal, they have no allergies, come see me, and instead we do a slightly different test. We do a sensitivity, or you could call it an intolerance test, and we do find results. So allergists are looking for full-blown allergies. They're not looking for sensitivities always, and that's something that, again, since functional medicine aside, we are looking for, we'll just say, reactions that are to a lesser degree that may not be as recognized as the full-blown anaphylaxis to an allergist is.
Let's say I'm one of your patients and we're having this conversation like we're having right now. What would you then say is the next step, or what would be your next step or mine, or tell me what the process would be?
For the complaints you were just mentioning, or just in general?
For what I just mentioned.
Sure. So beyond going off dairy, of course, I would recommend we test you for food sensitivities, because dairy may be one of several food sensitivities that you need to remove. And then I would have already taken a thorough history, so I would have definitely known whether or not you had taken many antibiotics in your life, because many patients with the symptoms you're complaining of do have yeast overgrowth. And when you think of dairy, like cheese is moldy, right? There's yeast fungus in there. So many of my patients also need to undergo not just a dairy-free diet, but we need to put them on a yeast cleanse. There are several ways we can test for yeast sensitivity. We can even do a stool test to see if yeast is growing in their gut. We can do some blood tests. We can do urine testing looking for yeast metabolites. But with a patient like yourself, I would definitely be interested in the gut health, to see how much good and bad bacteria or yeast are present. So obviously, if you're low on good bacteria, that's where fermented foods and probiotics would come in. I'd put you on a gut healing protocol, and then probably end up treating yeast as well.
You said fermented foods would be introduced or continued, and isn't there yeast in fermented foods?
Yep. So what we do with patients is we first kill off all the bad, and then we have to rebuild the rainforest. So meaning we would slowly then introduce some probiotics and give you some fermented foods, unless you had a very strong sensitivity to yeast, because some patients, we want to treat if there's an overgrowth, but if they have a very strong sensitivity, then they may not tolerate fermented foods at all. So that's a case-by-case basis.
Oh, that's interesting. You just made me think of something that I've been sort of puzzled over. I'm not a big alcohol drinker, and a part of that is that whenever I drink wine, beer, or cider, I get what I call rot gut. My stomach hurts really bad. Not like quite nauseous, but it it really hurts. It feels like it's kind of being rotted away from the inside. Like if you picture an old rusty piece of metal, that's kind of how it feels. And
Sure.
do you think that might have something to do with yeast?
A yeast or gluten. So let me ask, is it specifically beer or also with any liquor or wine?
Hard liquor tends to be okay, but it's beer, wine, and cider.
Yep, so you pretty much just did answer that question. So many of the liquors are gluten-free. Obviously, they're lower yeast, right? They're not fermented like a cider or a beer would be. And so I would, again, that's more evidence to suggest with you that you do have yeast overgrowth. Or it could also be a gluten sensitivity, because in beer, right, beer, depending on hops or whatever the ingredients were to make that brew, usually those beers contain gluten. And so it could be the gluten, it could be the yeast, could be both.
Very interesting. So let's, because I eat other forms of gluten, bread and
Yep.
wheat-based cereal and things like that, and I don't have any issues at all with that. If I wanted to test myself for this being yeast, is there something I would eat or not eat?
Well, you know what? I'm just thinking of a little litmus test you could do on yourself. So you could even buy some gluten-free beers, and you could, so to rule out whether it's just too much gluten. I know you're thinking it may not be gluten, but in this form, so you could try some gluten-free beer, and if you still have the same problem, then we know it's not the gluten.
I actually have, and I do still have the same problem.
Sure. So then you're probably right. This probably is a yeast issue. There's no, how do I say this, without utilizing the help of a functional medicine practitioner, there's not a test, I guess, that would be commercially available for you to, to purchase and test yourself for. But I think maybe through our conversation, we already have enough data to know that this is likely the problem.
Yeah. And I wasn't, and certainly I'm not trying to steer patients away from you. I was thinking it might be something like when you want to, abstain from eggs or dairy and then reintroduce it to see if you have any more reactions coming back in. I was talking with somebody just a few days ago who eats paleo all week, and then she has a cheat day or a cheat meal, and she eats bread, and then she feels really bloated for about 24 hours. Mm-hmm. So my response to her was, don't eat bread.
Right.
Clearly,
right.
Your body doesn't like it. Yet she didn't like that answer because she wanted to find a way where she could eat bread.
Right.
And then the other answer is, okay, well then eat it every day. She didn't want to do that either. So she wants to solve the problem without solving the problem.
Right, which is not possible. I think I may have heard your question wrong too. I think I was hearing you as, is there a test that someone could run on themselves? But maybe you're asking more for what diet changes, would be available to that patient. So we know sugar feeds yeast, and that's what, these fermented alcoholic beverages, they're loaded with sugar and yeast, and that's just further driving the yeast load.
Yeah.
So really cutting out the carbs, because carbs convert to sugar, sugar, and alcohol, just giving your gut a rest would be very important. And then with my patients, and I do discuss this in my book that I mentioned, I would probably put you on, I think you could benefit from a yeast cleanse as well. And so that's taking some botanicals, so some, we'll just say herbs, to help further reduce the yeast load. So if we can get the yeast load down, there's a chance that you could tolerate some beer, right, in moderation in the future, but maybe just not as much. But right now, what you're having is putting you over the edge, and you're having, these pains and obviously feeling uncomfortable. So I think by cleaning up the diet, that will help, we'll just say, suffocate out or quit feeding the yeast. And then even some supplements can be very beneficial. I use a product called Advanced Yeast Complex. That's one of our products. It has, I think, 10 different antifungal herbs to help further reduce the yeast load.
Okay, well, we can talk in more detail later on, and I'm pretty interested in that. And not that I even really care if I drink beer again. I was just very puzzled by that because I know a fair amount about nutrition and anatomy, and it was very puzzling to me. And that was something that I had thought of, but I hadn't talked to anybody who knew anything about yeast.
Well, that's also, I was going to say, I can't obviously examine you over the computer, but
right.
If you have many patients with yeast overgrowth, they have a furry coated white tongue. They'll get some plaque on their tongue. And that's, part of the head to toe assessment I do with all my patients is look in the tongue. See if yeast is growing. Look at their nails. Do many of my patients we're talking decades of yeast overgrowth, end up having fungus, systemic yeast. So they have fungus on their toenails, their fingernails. So there's a lot that I can even gather as a practitioner from the exam to see how bad the yeast overgrowth may be in that patient.
That's pretty interesting. Is there probiotics, a certain strain of probiotics or several that would help with that?
Yeah, the short answer is all of them. So I like on a stool test, I can see which species patients need, if they need lactobacillus or bifidobacter species or acidophilus. But generally speaking, I tell patients to take a broad spectrum probiotic, so not just one strain, right? You want 5, 6, 7, 8 or more strains at a pretty high potency. And you want to make sure that probiotic is like freeze dried or it's in some sort of capsule that's going to make it down past your stomach acid. And most of the probiotics, like you would get at for instance, a functional medicine practitioner office, are going to be very high quality, are going to be of this caliber. So yes, probiotics would be very helpful in this situation.
I'm taking one now that has 37 strains. I thought that was pretty good.
That's very robust. Yeah, that's a lot.
Now, I noticed you work with people about getting toxins out of their body. What sort of, I know we're breathing toxins and eating toxins all day, every day. We can't help it. If you ever drive on a road, you're breathing the fumes from the car in front of you and a little bit of tire dust and who knows whatever else is there. I was in a store the other day. I could swear I smelled turpentine or paint remover or something. It was horrid. Doesn't mean I'm being poisoned from it, but still, is there a way that people can get these toxins out of their body?
Yeah, I think number one most important thing is to minimize our exposure, which, like you said, sometimes is very difficult. Living in Iowa here, not that my windows are rolled down now because it's so cold, but during the summer, you roll your windows down, and yes, you're exposed to that auto exhaust, but also the herbicides and pesticides, from the corn is just flowing in and out of my car all day long. So there's a lot of my exposure that I can't minimize, but there are some things that I can. And I think the toxins in our personal care products have become more of a buzzword lately. There are many clean skincare, beauty lines that have been created. I don't know if you guys have talked about this much, but the parabens, the phthalates, the sulfites, a lot of these chemicals are very unfortunately dangerous to our endocrine systems. They can mimic estrogen. They can bind to estrogen receptors and cause problems, even like the endometriosis that I was mentioning, or in some patients, polycystic ovarian syndrome or whatnot. So I think one step that we can make is to clean up what we're putting on our skin, which is our largest organ. So there is a great reference or source, the Environmental Working Group. I'm not sure if you're familiar with them, but they have They have a skin deep database where you can type in any of your personal care products. So your deodorant, your lotion, your shave cream, your toothpaste, whatnot, and they'll rank the toxicity. So they'll rank how highly allergenic that product is. They'll rank the risk of it causing cancer, and they'll rank the risk of it causing endocrine or hormone disruption. And so I have my patients use that resource and slowly make safe swaps to reduce their toxic burden, right? What they're constantly putting on their skin. I think the average woman uses 11 to 15 products a day. And so if many of those are containing toxins, that's not helping our situation. So
is it enough to eliminate from putting it on, just stop putting it on and your body will get rid of the waste on its own?
Depends on how congested your system is. So there is truth. There have been trials even on patients who, let's say, started eating organic. Those levels of herbicides and pesticides have been shown to be cleared out of the system pretty quickly in a couple weeks in some patients. So it's hard to say if it's enough for every patient. If they ate organic and they didn't use any toxic skincare products, is that going to be enough? It's hard to say based on what toxic burden has accumulated through, their life. And so for many of our patients, it's not enough, and therefore we need to put them through a liver detox program, which essentially involves what we've already discussed. So I'll echo the clean eating that we mentioned. We always have patients take a rest from inflammatory foods and make sure they're eating organic for a couple weeks. And then I do put patients through a liver detox program. So there's two major components of that. So one would be herbs, so botanicals, again, what we call choleretics and cholagogues. These are things like artichoke, dandelion, beet, milk thistle that can help the gallbladder and the liver purge out toxins that have been in storage. And then you need a binder. You need like a protein powder with some fiber, maybe some activated charcoal, bentonite clay, something that can bind the toxins so that they can be excreted through the body, because otherwise the toxins get recirculated. So
that's what I've been wondering about that for quite a while.
Yeah. And you know what can even be more effective, which many of our patients love through the winter, is because it's so cold again here, is using a far infrared sauna. The sauna therapy, really detoxing through our sweat, has shown to be extremely effective.
Yes.
Sweat and
I get in the sauna at least every week, certainly throughout the winter and sometimes in the summer too.
Wonderful. Sweat analyses have really shown, they can test all the chemicals, heavy metals, whatnot, that are coming out of our pores in our sweat.
Ew.
And so something that is extremely important for our patients. We want them eliminating toxins several ways, through their pee, their poop, their sweat, and obviously we're exhaling toxins as we breathe out as well. So we want to make sure we're supporting all of those with our patients.
What about supplements? Are there any that you would generally recommend for a person to take for either good health and or maybe detox? Anything?
Sure. So the products that I mentioned, we have a combination. We have a Core Restore liver detox kit that contains the powder and then also the blend of the milk thistle, artichoke, beet, dandelion, whatnot, which also has some amino acids in there, which is for the most part, pretty safe for patients to take. Separate from that, one of my favorite products for detox is it's a multivitamin, but it's called mitochondrial complex. It has a lot of antioxidants in it to fuel glutathione production. Glutathione is the most important antioxidant in our body, and it's something that many of my patients are low on, and that's evidenced through the testing that we offer at our clinic. So if glutathione's low, we want to do everything we can to boost glutathione to support the detox pathways. So that mitochondrial complex is an excellent product. I feel much better when I take it. I'm not taking it now because I'm pregnant, but otherwise I would take it again. It's a multivitamin, but it has, we'll just say, more bells and whistles for detox to boost glutathione.
Fascinating. You mentioned PCOS earlier. What advice do you have for somebody who's suffering with PCOS?
Sure. So polycystic ovarian syndrome is PCOS, and it can cause weight gain in some patients, irregular cycles, fertility issues. They can have hair growth in abnormal places and acne, and some patients are more symptomatic than others. It's one of the hormone complaints that many patients present to my office having. I treat them. I don't want to make a blanket statement, but regardless of the diagnosis, whether it's reflux or fatigue or PCOS or whatnot, we treat all of those conditions the same. We work all those patients through our blueprint. So even for the PCOS patient, we want to start with gut health. And even, like I mentioned, removing the endocrine disrupting chemicals and detoxing her. We're going to walk her through all the same steps we would walk even you through, when you're having the congestion and whatnot, and the mucus production.
Wow.
That's the short answer.
That's completely fine. I do hear that was a short answer because it is a very complicated, affliction or illness, if you will. I'm not sure how to classify it. And it's one that really frustrates a lot of women. And I talk to them from time to time because they're interested in weight loss and they're rattling off all these things they're doing. And I'm not going to go into the details, but they tell me that they're exercising at pretty much an idyllic level and amount and all that stuff. And as with 20 years as a personal trainer and exercise physiologist, I can corroborate what they're saying and kind of classify that, yeah, they're doing it exactly right. Also, their eating is what I would call as right as it can be. And Sure. They're getting good sleep and all those things, but they still gain weight.
I'll tell you one more thing I'll speak to on PCOS, which my second book I'm actually focusing more on specific hormone conditions, PCOS being one of them, but progesterone is oftentimes low in those patients. And so many times just getting those hormones back in balance is very important. So with the multiple cysts, they can secrete androgens. So many of these patients have higher testosterone, higher DHT, hence the hair growth and the acne. but they have very low progesterone, hence they're not cycling regularly. Many of them get anxious or have mood disturbances. So boosting progesterone, just getting those patients more hormonally sound, greatly helps facilitate the body's ability to, get that weight loss result from the exercise they're doing. So many of those patients, one of the first things we're doing is we're checking their hormones to see if they have low progesterone, and either using herbs or I'll give them bioidentical natural progesterone to help bring those hormones, again, back into balance. If we need to lower the androgens, we'll lower the androgens as well.
Dr. Gray, it's been fascinating speaking with you. You have a wealth of knowledge in functional medicine, and I really love all the different things that you can treat and improve a person's life without filling them up with drugs with a bunch of side effects. Remove things is more likely the advice than to add things. How can somebody get a hold of you?
Sure. So we have two different websites. We have one which is yourlongevityblueprint.com. That's where my book and our supplements, I have many video blogs there. Also, we have a YouTube channel, which you can find links to from yourlongevityblueprint.com. And on that website, we're offering 10% off discount if you're interested in the book or any of the supplements we mentioned. If you use the code THANKSLIVEFIT, you'll get 10% off. My clinic website, which you can also access from that site, is ihhclinic.com. That stands for Integrative Health and Hormone Clinic.com. So that's what patients would use for consultations, whatnot. And then you'll see our links to all of our social media accounts through those websites as well.
Okay, and just a clarification, it's Live Fit, not Live Fit. I know a lot of people, it's hard to tell because that darn word is spelled the same for two completely different pronunciations, like read and read. So I just want to throw that out there. It's Live Fit Podcast, livefitlean.com is my website too. So I'm going to have all of those links that you mentioned and several more on the livefitpodcast.com website. You can look this up under episode number 136 with Dr. Stephanie Gray. Dr. Gray, thank you once again. This has been very eye-opening.
Well, thank you for having me. This was fun.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes